This bit of equipment is standard stock from Medicare catalogue. Underneath, as you can see, the sheet that attaches onto the bed has a very rubbery edge and also a very rubbery middle section which has been previously locked off to help minimise the risk of sliding down in between visits. So what we need to do here is slide the patient up the bed, and we're also going to use these loops on the edge here to assist the patient to roll in the bed. The first thing we need to do is we need to bring the piece of slide sheet upwards, which covers this area here, which was used to lock off the patient after our last visit. So we should both have a yellow strap on both sides. And once we have that strap, we're then going to feed that middle portion up the bed so that eventually, okay, are we there? Yep. So we're now covering off that middle slide bit. If you have any difficulties, if it rocks up underneath any part of the body, you can use the slide sheet mitt to just feel around to try and help you untangle that piece in the middle there. The other thing we're going to do before any sort of movement in the bed is just take off these corners here, which are another system of locking off. So first of all, we're going to slide the patient up the bed. So in our fab stance, so flex knees, alignment, and also a really good base. We're going to hold a nice chunk of that material, and on the word slide, we're going to slide up the bed. Okay, so ready, steady, slide. So a really good controlled slide. Then from there, we're going to start to bring in that hoist, because we're going to now assist the patient to roll in the bed. So at this point, we could give the patient the remote control if they feel that they are able to use it. It helps to add a little bit of independence. So from here, we probably need to do a little bit of a slide that way first of all. So my colleague's just going to use that material there, and he's just going to do a little bit of a pull of the patient onto the side there, so that when the patient rolls, they're not going to be too close to the edge here. I'll be on this side as well to help with that slide. So ready, steady, slide. So it's only a little bit. These sheets are very, very slippery, so you need to be very careful about how much force you need. Then we're going to bring that spread bar down. That's it. And we need to make sure that that spreader bar is roughly in line with hips and shoulders. They're heaviest parts of the body. And we're going to attach those straps on at that point. We also need to encourage the patient to bend his knee, and if we can put that hand across and looking at me. And here, if you need to use that mitt just in between the head and the pillow, just to pull the pillow towards you a little bit, just to get a bit more room on that pillow for the head once it rolls. Okay, are you ready to go up? Whilst the patient's moving the hoist up, I'm constantly looking at where the body is. I want to make sure that they're not too close to either side of the bed, that they're safe and they're comfortable, and stop there. That's good. And then from there then, if you'd like to grab that wedge, and we're just going to put it behind the material because we haven't got enough space here at the moment. Do you feel balanced? More balanced on your side? Yeah, that's it. That's the wedge. Okay, and then I think, are you on your side enough, do you think? Yeah, okay, and then we're just going to lower that spreader bar. And then from here, we've got me supporting and the wedge in place to keep the patient on their side. And then we can just unclip at the spreader bar. Okay, and then up. And then we can just move that hoist out of the way. Thank you. And then to make it more comfortable, we can then change the position of the wedge to put it on top of that top sheet. If you need the wedge. That's good. And then just to help secure the patient in that position so that there's less risk of moving in the bed, what we can then do is with this middle section here, we can lock that off onto the non-slippery mode. So from there, we're just going to both pull that yellow handle all the way down as far as we can go. Okay. And then just make sure that that material is all nice and flush. I can't reach my corner here, but we can put them there, and we could tuck that side under if that was possible. And we do have the same loops or straps on the side of here, so if at some point, maybe after 2 or 4 hours or however long you needed to, you would then do the exact reverse. You would bring that spreader bar down, you would attach these two loops onto the spreader bar, and then you could potentially roll back onto the back or in the other direction.